I was grateful and privileged to give birth to Dr. Stanford half a century ago. The one thing that I always told her and her brother was in 1970, the word can't was not written in a dictionary.
There was nothing that I thought I could do that she would say, no, you can't. She would just say, okay, so how are you gonna do it?
And I think that's a rule and a consistency that Dr. Stanford has to this day because she has not told Philadelphia or the world can't.
I first realized that not everyone had access to health care, probably being in the emergency department as a young child and waiting and waiting and waiting and waiting and waiting. And then when I got to medical school and I started learning about these social determinants of health that dictate how certain groups have poorer outcomes, and so much of it seemed to be blamed on the patient, I was like, oh no, that is not my experience at all. There were presuppositions of why people thought my mother went to the ER. Like, why are these parents abusing the emergency department? Well, maybe because my mom gets up before the sun comes up to go to work, and then she goes to a second job. And by the time she gets home at 9:30 or 10:30 at night, every place is closed. So the only place she could go to make sure we had our physicals for school was the emergency department. So there was this look of shame I felt from healthcare providers when they looked at me. There was this lack of urgency to take care of me. And so you couple the bias that's in the hospital with the untrustworthy health system that many in the Black community face, and then you put a pandemic, and it's a perfect storm. Because who you need to go to the most aren't necessarily opening their arms for you to come, and you wouldn't trust them even if you went, right? And it just became very simple to me.
The light just went on, and she just decided, I have to do something.
She decided, hey, Ma, go rent a van, because we gonna go on the streets and start COVID testing. And I went, I got a van. She told me, don't tell them what you're getting it for, just get a van.
And I didn't ask anyone what they thought. I just said, look, here's the name, Black Doctors COVID-19 Consortium. And I saw the faces, but what I was doing was trying to connote trust. And those were the folks we were taking care of that had the highest rates of disease and death. And I wanted them to see in the title that that's who we were. Through my church, Salem Baptist Church, and my pastor, we talked about where a safe place was in the Black community. Here we are, a year and a half later, and like over 100,000 people touched. Right now, the percentage of African Americans vaccinated for coronavirus disease is greatest in Philadelphia than any other major city in the United States. That is not by accident. We may have started with COVID in the pandemic, but my goal is to have better health outcomes, to promote health, to prevent disease, so people can enjoy every year of their life, every minute of their life, and the things that we can prevent, that we can help people get there to do it.
Ayla's passion, it's her caring, bedside manner, it's contagious. And with her being so inspirational, a lot of people have latched on to her and want to be a part of what she's doing.
Her service is genuine. She's not doing it for recognition. She's doing it because that's who she is.
The trust that the people put in us, quite honestly, of all colors, has really allowed me to win an award like this.
It's somewhat amazing because it is my daughter, but all great people start from somewhere.
I realized that she believes in the Hippocratic Oath. I always think of that Negro soul song that says, if I can help somebody as I pass along, then my living shall not be in vain. And I make that her theme song because she lives that. She lives at each and every second that she breathes.
So as far as I'm concerned, this is an award for all of us and an example of when we work together, what we can do together. It's not just my celebration, but it's everybody's celebration. That's special. That's what's up.